Rotator cuff tears are a widespread issue, especially among middle-aged and elderly individuals. The rotator cuff is a group of four muscles and their tendons that stabilize the shoulder joint and allow for a wide range of arm movements. Tears can result from sudden trauma, like a fall, or develop gradually due to aging and repetitive overhead activities. These injuries can range from mild tendinopathy to severe full-thickness tears, sometimes leading to a condition called cuff tear arthropathy. Symptoms often include pain, weakness, and limited range of motion, making everyday tasks challenging. Notably, the prevalence of rotator cuff tears increases with age, affecting up to 60% of people over 80. However, many people may not experience symptoms and remain undiagnosed. Understanding the structure and function of the rotator cuff is crucial for appreciating why these injuries can be so debilitating, and why effective management is essential for maintaining quality of life. Diagnosing a rotator cuff tear typically starts with a clinical examination, where doctors assess shoulder function, strength, and pain. Special tests such as the Neer and Hawkins-Kennedy signs help pinpoint the problem, while imaging like MRI or ultrasound provides a detailed look at the tendons and muscles. Once diagnosed, many patients begin with non-surgical treatments. Physical therapy is often the first step, focusing on exercises to restore movement, strengthen muscles, and reduce pain. Activity modification, avoiding overhead motions or heavy lifting, can also help. Pain management may involve NSAIDs, acetaminophen, or alternative therapies like acupuncture and TENS. For more persistent pain, corticosteroid injections or platelet-rich plasma (PRP) therapy might be considered. These options can be especially effective for smaller tears or for patients who are not ideal candidates for surgery, offering meaningful improvements in pain and function. Non-surgical treatments are not enough, or for larger and more complex tears, surgical options come into play. Arthroscopic repair is a minimally invasive technique that uses small incisions and a camera to repair the torn tendons, leading to less pain and faster recovery. Open repair, while more traditional, is still used for larger complex tears, though it typically involves a longer recovery and higher risk of complications. Mini open repair combines the benefits of both approaches. For irreparable tears, advanced procedures like tendon transfers, reverse shoulder arthroplasty, and superior capsular reconstruction offer hope. These techniques are tailored to the patient's specific needs, considering factors like age, tear size, and overall health. Innovations in biologic augmentation such as PRP and stem cell therapy are also being explored to enhance healing. Ultimately, the choice of surgery depends on a careful evaluation of risks, benefits, and patient preferences. Choosing between surgical and non-surgical management for rotator cuff tears involves weighing both clinical outcomes and economic factors. Research shows that surgical treatments, especially arthroscopic repair, often provide better long-term pain relief and functional improvement, particularly for younger patients or those with significant tears. However, non-surgical approaches like structured physical therapy can offer similar benefits for smaller or less severe tears, sometimes matching surgery in terms of quality of life and disability improvement. Cost-effectiveness studies reveal that while surgery has higher upfront costs, it may reduce long-term healthcare expenses by minimizing the need for ongoing treatment. Advanced surgical techniques like superior capsular reconstruction and reverse shoulder arthroplasty, though costly, can be justified by their superior outcomes in specific patient groups. Ultimately, the best approach is personalized, taking into account the patient's age, tear severity, health status, and personal goals. Rehabilitation is a cornerstone of recovery, whether after surgery or with conservative management. Early stages focus on pain control and gentle movement, progressing to active exercises that build strength and restore function. For surgical patients, protocols are carefully structured to protect the repair and gradually reintroduce activity. Supervised physical therapy and bracing can optimize outcomes, and new research suggests that more aggressive rehabilitation may offer slight functional benefits. Looking ahead, advances in minimally invasive surgery, biologic augmentation, and regenerative medicine are shaping the future of rotator cuff tear management. Personalized treatment plans, improved imaging, and innovative therapies promise even better outcomes. The ultimate goal remains the same: to restore shoulder function, reduce pain, and enhance quality of life for every patient.